Hello everybody, and welcome to Passive Range of Motion. I'm here with John.
Yes.
He's going to complete the exercises with us, and we're very excited. Passive range of motion can be a bit boring, so John and I are here to work out with you.
Yes.
A couple important things before you start these exercises. You want to make sure that you consult your local occupational therapist to make sure these exercises are appropriate for you. When completing these exercises, make sure that you maintain good control of your weak arm and make sure that the weak thumb is on top. The first exercise is going to be a seated chest press. I'm going to have John demonstrate the exercise and then we're going to complete it. Each exercise is going to be completed for 1 minute with a 15-second rest break in between, and we have 7 total exercises. So go ahead, John. Perfect, and come on back. We're going to put a minute on the clock and we're going to get started. So we're going to bring our arms into our chest and straight out and back. The first thing that I want to point out, the most important thing, is that you stay in your pain-free range. If you're feeling any pain or discomfort, you want to really back off of that range of motion. John is going nice and slow and controlled. He's getting really great elbow extension. He's counting his reps. You should get typically, I would say, about 10 to 15 reps within the minute. If your arm is a little bit tight or it feels a little bit stiff, you really want to make sure that you go slow. You can hold the stretch. The counter is there, the timer on your screen is there so that you can use that as a way to hold that stretch for a certain period of time. We have 10 seconds left, and then we're going to take a 15-second rest break. How you feeling, John?
Good.
2 and 1, we're going to take a rest break. At this point, you really want to make sure that you have a good grasp. If you need to readjust or you need to get comfortable in the chair, please go ahead and do that. We're going to start our next set in 3, 2, and 1. Go ahead, John. So John has a daily routine that he completes at home. He does his exercises, his passive range of motion in the morning. And when John and I first met, which was probably about, I'd say it was about 5 years ago, John had a very painful shoulder. And he has progressed, significantly through exercise, through therapy, through his range of motion, and he continues to impress. So both of us are excited here to do these exercises with you to keep you motivated. We want to keep our muscles mobile, we want to keep our joints flexible, and we really want to make sure that we take our time to do passive range of motion. We're almost there, and our first exercise will be completed. What number are you on, John?
5.
5. So we have 10 seconds left. And like I said, keep at your own pace. You know, no one's in competition. We want to keep moving and feeling good. The second exercise is shoulder flexion to 90 degrees. And again, before completing this exercise, please consult your local occupational therapist to make sure this exercise is appropriate for you. I'm going to have John demonstrate. He's going to interlock, he's going to clasp his hands, and he's going to raise his arms up to 90 degrees. Go ahead, John. And then we're going to bring it back down. We're going to get a minute on the clock and we're going to get started. And we're going to go ahead, John, and we're going to bring it back down. With shoulder flexion, you really do want to make sure that you're not having any pain. If you have had any past shoulder injuries, you want to make sure that you're not causing any more discomfort by completing this exercise. If you can't go completely up to 90 degrees, I'd like you to stop when you feel like you need to. Again, John is maintaining great control of his affected extremity, and he's bringing his arm and he's getting a nice stretch. I think what I pass on when everybody's completing exercise is that you listen to your body. Nobody knows exactly how you're feeling but you. And again, John, you want to come up and then you want to bring your arms straight back down, trying to keep those elbows as straight as possible. We have 10 more seconds before we take our 15-second rest break, and we'll have finished our first exercise. 3, 2, and 1. So we're going to take that 15-second exercise. Make sure that you are breathing. Make sure that you're staying hydrated. If at any point you need to stop and take a break, go ahead and do that. You can always press pause and start back up. We're going to start our second set of this exercise. Let's go, John. Hope everybody is feeling good at home. John is looking great here. If you can at this point and your shoulder allows you to do it, you could go past 90 degrees. I'm going to ask John to show that. On the next round, John, after you bring it down, can you bring it up a little bit higher than 90 degrees?
Yeah.
Let's see. Perfect. Make sure that you're able to do that. Make sure that your shoulder has no discomfort when you are completing that exercise. And if you need to hold that stretch for a little bit, you can go ahead and do that. John's looking good at home. We developed these exercises to keep you motivated. We find it so important that you complete these range of motion and stretching exercises at home, and it can be a little bit difficult. So hopefully you're enjoying exercising with us. We have 5 seconds left, and exercise number 2 is completed. Looking good. Our third exercise is elbow flexion and extension. John's going to demonstrate that. You're going to interlock your hands. You're going to start with your hands down at your knees, and you're going to bring it up to your chest, and then back down. We're going to put a minute on the clock, and we're going to get started. Now with this exercise, you really want to make sure that you try to bring yourself through full range. If you cannot, you're going to bring your arms up. John's doing a great job, but you're going to hold it. And you can keep going, John. And you're going to try to feel that stretch, and then you're going to come back down. This exercise is really very important for a lot of the functional activities that we do throughout the day. So you want to make sure that you take your time and you complete this exercise with full stretch. Don't forget to breathe. Very important to breathe while you're exercising. It kind of helps relax everything, kind of helps you improve your range of motion. We have about 20 seconds left. John is doing a great job. Hopefully you guys are feeling as good as John is feeling. How you feeling, John?
Good.
Good. You're looking good too. We have 10 seconds before we take our 15-second rest break, and we'll be finished with this first set. 3, 2, and 1. Again, while you're taking this rest break, make sure that you stay hydrated. Press pause if you need to. Make sure that you drink. Readjust your hands if you need to. We have 5 seconds, and we're going to start our next set. Go ahead, John. Again, when you're working with an occupational therapist, make sure that they have agreed that this is a good exercise for you. Check with them, consult. We're going to provide a checklist of all the exercises that we have, and you could bring it to your occupational therapist or your therapy session, and you could check off which exercises that she feels are appropriate for you. We're here to get you determined. We've made these exercise videos for you. We're very excited about them. It's so important as you recover and you continue to make gains that you really incorporate passive range of motion and stretching so that your progress will continue to be successful. John, who is probably used to me because he's worked with me for about 5 years, has been really good about completing his exercises and continues to be successful at home by making gains. We have 3 seconds, and we're going to take a break, and we're going to be finished with exercise number 3. Exercise number 4 is forearm supination and pronation. John, let's show them how to do that. What you're going to do is you're going to rotate your palm down, and then you're going to rotate your palm up. Let's get a minute on the clock. As you complete this exercise, you might want to take your time. A lot of individuals who've had a stroke can be very tight going into supination, which is when you have your palm up. So you want to take a little extra time to make sure that you can get that range. Bring it there nice and slow, hold it, bring it back down, and then try to gain a little bit more range as you go back around. We're really, on this one, we're not exactly looking for repetitions. We're really looking for quality of movement, and the quality of movement is going to show improvements really throughout your rehab. I mean, we want full range of motion. We want to make sure that it's done slowly and with control. You never want to force this movement. You want to make sure that you go nice and slow. John's doing a great job. He is using his left arm to help move that right arm over, and he's getting a really nice stretch. We have 5 seconds left, and then we're going to take our 15-second rest break. 3, 2, and 1. 15-second rest break. If the pillow, you need to adjust the pillow, go ahead and adjust the pillow.
No.
But You're okay, John, but it really is important that you have that support so that the movement just occurs there. And you're doing a great job with that. We're going to start our next series, and we're on. So set number 2, after we finish this, we're going to be halfway there. We're going to have 3 exercises to complete after this. Please do, I know I keep repeating myself, you want to use that timer as a stretch. John actually is able to complete the range of motion. He's doing a great job. How's it feeling? Does it feel tight?
Very good.
Very good. Where are you feeling that stretch, John? Do you feel it over here on the forearm?
Yes.
That's typically where you feel it, and you do, like I said, hold it if you need to. If not, keep going. You're probably, again, getting about 10 or 15 repetitions in, which is a great amount to maintain and increase that circulation in your arm. What we're trying to do is we're trying to prevent any kind of contractures that can form as you continue to rehab and regain function in your arm. We're almost there. We have 5 seconds left, and we'll be finished with forearm supination and pronation. Great job, John. Exercise number 5 is wrist flexion and extension. Again, you're going to have your hands placed on the pillow. You're going to interlock your hands, and the movement's going to be at the wrist. Let's have John demonstrate. Yep, so you're going to bring the wrist side to side. Let's get a minute on the clock and let's get started. The most important thing that I would like you to try to do when you're completing this exercise is really try to keep your fingers relaxed. The more relaxed your fingers are, the easier and the more range of motion that you'll get at the wrist. So the movement is really happening just here. John is doing a great job. We're moving the wrist back and forth, staying in a pain-free range. If you are feeling pain, and it's not a pulling, stretching pain, then you really do want to back off. But if you're feeling a stretching pain, hold it for a little bit. Hold that wrist into that position. The position of your wrist is important when completing any kind of functional activity. So we really want to make sure that we take our time and we look at the quality of our movements in the stretch when completing this exercise. We have 10 seconds left, and we're going to keep going. And then we'll take our 15-second rest break. How you feeling, John?
Good.
Good. Hopefully you guys are feeling good at home. You can take a rest. John's looking great. Hopefully you're having some decreased stiffness and tightness in your arms as you're completing this and regaining improved range of motion. You kind of want to keep track of how much range that you have and how much range that you're gaining. We're going to start our next set. We have a minute on the clock. Quality. I know I keep talking about that, but that is important, especially with the stretch and with range of motion. And you want to make sure that you're going at your own pace, you're feeling good, looking at your posture, staying up nice and tall. There's several different ways to stretch the wrist. This one is a great way. It's easy. You can do it yourself. It's nice to be able to complete exercises at home. You are really using your unaffected arm to help move you through that range of motion and feeling good. So we're going to have 2 exercises to complete after this. We're almost there. Range of motion will be done. We have a few extra series in here that we want to keep going with to kind of show you how to bring your arm into function. We have 2 seconds left, and we're good. Exercise number 6 is finger flexion and extension. And what you're going to do is, again, you're going to rest your hand on a pillow, preferably with your palm up. John's going to demonstrate, and what you're going to do is you're going to bring your hands into your palm, yep, and then bring them straight out. Now, the hand can get tight. We're going to put a minute on the clock, and I'm going to talk about a couple different ways that you can do this. John's going to end up holding his for a little bit, and he's going to bring it in, and then he's going to stretch it. We really want to make sure that we take the time to stretch the fingers into extension. So as you're working this, if your hand does feel like it's getting tight, really take the time to give it a good stretch. Try to breathe. Sometimes breathing will help relax you. And keep working it. That looks much better. You don't want to force it. You don't really want to force the movement. And if this is getting tough for you, what you can do, I'm going to let go of your thumb here. The thumb sometimes tends to want to go in. I don't want you to stop the exercise. I want you to keep going and try to work around that thumb, but really trying to stretch those fingers. If you're having a tough time, what you can do is what John's starting here. And I'm going to let John take a rest. We have 5 seconds left, and then we're going to take a 15-second rest break. And I want you to do that. We have a timer going. We're going to take a rest break. Everyone at home, I want you to take a rest break too. If the fingers are getting tight, it's okay to take a rest. It's okay to stop. It's okay to let your hand rest, put it into a stretch. You could even turn it down and let it stretch. You don't want to force, you don't want to fight with it. We're going to put another minute on the clock. We're going to get started. And what you can do here is I'm going to have John show us, is what you can do is you can individually stretch your fingers. So I'm going to have John relax, and what he can do is he can bring one finger in, and then he can bring one finger out. And then you can bring one finger in, and you can bring one finger out. And you can bring one finger in, and then you can bring the other one out, instead of having them all come in at once, which can be a little bit difficult. So I want you to, perfect. That looks great. So if the hand is getting tight, don't try to fight with it. Try to figure out different ways to make it happen so that you get that stretch. That looks great, John. And if the hand starts to feel relaxed, you can go back and you can start to do them all together. But really, you want to make sure that you can find the right way to get those hands to stretch. And don't forget, you can always, at this time in this section, is bring the fingers out and hold them. We have 2 seconds left, and we finish finger flexion and extension. Exercise number 7. We made it to the end, John. Okay. It's movements of the thumb. Again, you're going to rest your hand on a pillow. And what you're going to do is I'm going to demonstrate the movements. And in the first set, I'm going to complete the movements for John so he can get the movements down. And then John's going to complete it on the second set. So what you're going to do is you're going to gently hold your thumb, and you're going to bring it down to the base of your palm, back up. You're going to come back down, and you're going to go side to side. Let's get a minute on the clock, and let's complete those together. So what you're going to do is you're going to bring the thumb down to the base of your pinky, and then back up, making sure that you don't overstretch, making sure that you don't overextend, and then you're going to go side to side. The importance of not overstretching is that if you have any past thumb injuries or injuries to the hand, you want to make sure that you don't aggravate them. John had a CMC joint replacement. Yeah. Was it several years ago in both hands? So you want to make sure that you do range the thumb. You just want to make sure that you don't overstretch it. So see how the thumb's feeling, see how the thumb is moving, and give it a stretch. John's thumb is actually relaxing as I bring him through here. You do want to make sure that you're breathing. You want to try to relax and let your arm and your thumb go through the movements. We have 5 seconds left. Then we're going to take that 15-second rest break, and then I'm going to have John show you how to do these. Looking great. So we have that 15-second rest break. Make sure that you go slow. I think that's probably the most important thing while you're doing this exercise. Get the movements down and go nice and slow and feel that stretch. This is the last minute. Perfect. So you're going to go down towards the base of the thumb. You're going to bring the thumb down towards the base of the index finger and then back up. Perfect. You're going to come back down and you're going to go side to side. That's looking great. I don't want you to get too caught up with the movements because I want you to listen to your body. What we really want you to do is start stretching and moving that thumb. Yeah, don't overstretch too much. Okay. Come on back down, and you're going to go side to side. Yeah. John's looking great over here. His hands relaxing. He's getting increased range of motion, and he's looking good. Perfect. So again, you're going to bring your finger down to the base of your pinky and then back up. Then come on back down, and you're going to go side to side. 5 more seconds, and you've finished and completed passive range of motion. Thank you so much, everyone, for working out with John and I. I hope you're feeling good. You did a great job.